Today I'm going to talk about another lifestyle-related medical condition, and we call it high blood pressure or hypertension. I'm going to discuss about what blood pressure means, how it affects your body, and how it damages your organ, what are the causes, and how to check blood pressure properly, and what you can do to control and prevent high blood pressure. High blood pressure is actually a force of blood flowing through your blood vessels, and when it is consistently too high, we call it high blood pressure. Nearly 50% of American adults, they do have high blood pressure, and surprisingly, many don't know they have it. High blood pressure is one of the most significant but modifiable risk factor for cardiovascular disease, stroke, end-stage kidney disease, and mortality. If you look at the slide, you can see that the normal blood pressure is 120/80, which means your upper number should be less than 120 and your lower number should be less than 80. And the lower number we call it diastolic blood pressure, and the upper number we call it systolic blood pressure. If your upper number is between 120 and 129 and your lower number is less than 80, then we call it elevated blood pressure. It means that you are at risk for having high blood pressure, so you should be careful and start modifying your lifestyle. Then if your blood pressure is greater than 130 and your diastolic blood pressure is greater than 80, then it is called hypertension or high blood pressure, but it is stage 1. If your upper number is greater than 140 and your lower number is greater than 90, we call it hypertension stage 2. And then you see in another condition, we call it hypertensive crisis, in which your upper number is greater than 180 and your lower number is greater than 120, and at the same time you can have target organ damage, which we diagnose with some other tests, which can be blood test or electrocardiogram. And if you do have these high numbers and hypertensive crisis, then you should call your doctor immediately or go to the emergency room, because you can get serious complications. So what are the consequences of chronic hypertension or sustained hypertension? So as you can see, it can affect multiple organs, especially your eyes. If your blood pressure is chronically elevated, it can cause vision loss. And in case of hypertensive crisis, you can have bleed in your eyes as well. Then your brain is very important. If your blood pressure remains elevated for a long period of time, then you can have memory changes, you can have problem with specialized brain functions. And if you get hypertensive crisis, then you can have a stroke or brain hemorrhage. Same thing with kidneys. If your blood pressure remains chronically elevated, you can lose kidney function slowly. Or if you get hypertensive crisis, then you can have acute kidney injury or acute renal failure. If you have an uncontrolled hypertension for a long period of time, then your heart gets bigger in size and ultimately it goes in failure. And if you get hypertensive crisis, you can have a severe heart attack. Always remember that hypertension is a silent killer, which means that most of the time there are no symptoms. If you ignore your blood pressure because you think that you are going to get symptoms, then you're putting yourself at a dangerous condition. The best evidence indicates that high blood pressure does not cause headache or nosebleed unless you have hypertensive crisis where your blood pressure is above 180/120. Similarly, a lot of people think they are having dizziness because of high blood pressure, but in reality, dizziness is not caused by high blood pressure. It is actually a side effect of high blood pressure medicine. Never think that if you do not get symptom, then you do not have any high blood pressure. If you do get symptom, it means you are having a serious complication of high blood pressure. And always remember, it's a silent killer. The United States Preventive Services Task Force recommends screening for hypertension in adults greater than 18 years of age to identify those at increased risk of cardiovascular disease from heart and to begin early interventions to decrease this risk. Adults age 18 to 39 with blood pressure less than 130/85 and without cardiovascular risk factors should be screened every 3 to 5 years. And those who are above 40 years and at increased risk for hypertension annually. So regarding the blood pressure diagnosis, the best way to diagnose you with blood pressure is to have multiple readings on multiple occasions. Ideally, out of office automated monitoring or self-monitoring of blood pressure measurement is recommended to confirm hypertension diagnosis. Compared with single readings, multiple readings are always helpful and better for confirmation of high blood pressure. Proper technique of checking blood pressure. When you go to your doctor, doctor's office, make sure that you have not smoked, have any caffeinated beverage, or exercised within 30 minutes before checking your blood pressure. Make sure that you're properly seated in a chair and rested for 3 to 5 minutes. Your legs should be uncrossed and your feet should be on the floor. Your back is properly supported and the arm bared and supported on a flat surface. The cuff size should be appropriate. And two common reasons for elevated blood pressure in the office. One is if the cuff size is too short or if the patient has not rested properly before checking the blood pressure. And always remember, multiple readings are always preferred because I don't consider one reading is enough to diagnose you with high blood pressure, or even if you are monitoring your blood pressure, we still need multiple readings, and home monitoring is always better. You can use electronic blood pressure monitor or you can use a traditional. Ideally, I would recommend using electronic blood pressure monitor because it is not operator dependent, and I would recommend using the arm blood pressure monitor instead of forearm monitor. Blood pressure we don't diagnose with any blood test or any other testing. We do blood tests and some other specialized testing to make sure that you're not having any target organ damage. And same thing, we take a detailed history of a patient and do a proper examination to look for any underlying risk factors or target organ damage. So regarding your history taking, we try to look into your risk factors like your lifestyle to make sure that you're not having any risks which are causing your high blood pressure. And same thing, we need to make sure that there are no other secondary causes of high blood pressure, like some people have underlying hormonal imbalances which can also lead to high blood pressure, or they can have a renal artery problem which can also cause high blood pressure. And these are the problems which can be fixed, so they need to be addressed appropriately. And how we diagnose these things? By having a proper history. Like your doctor needs to evaluate all your symptoms, like a detailed review of symptoms of all the organs. Clinical evaluation is very important because we need to find out if you are overweight, if you have risk factors for having high blood pressure, what are your dietary patterns, what is your lifestyle, and what are the barriers which you have to change your lifestyle and to control high blood pressure, and also to make sure that you're not smoking or not drinking too much. Then we also try to find out if there is any genetic element or you have any familial pattern of high blood pressure. So these are some important issues. Regarding testing, we do a baseline blood workup which requires electrolytes and especially your kidney function to make sure you're not having any kidney damage because of high blood pressure. And when we start you on certain medication, we still have to check renal functions and electrolytes periodically. And there are some hormonal problems which can lead to high blood pressure, and we can look at the electrolytes, and because of their levels we diagnose those secondary causes of high blood pressure. Then ECG is another important test we do as a baseline, and we need to make sure that if your heart is enlarged because if you have any underlying EKG changes, or it can also give us information about if there's any previous event happened like heart attack or some heart disease. And then there's another important test we do, echocardiogram. Echocardiogram is not routinely recommended, but if somebody's having a white coat hypertension, which means that you have high blood pressure while you are in the doctor's office, so we check it to make sure if your heart is enlarged or not. So if your heart is enlarged and you have white coat hypertension or doctor's office hypertension, then we can start you on treatment early, especially the medications. So 90% of the cases, we do not have a specific cause. It is very strongly related with your lifestyle, what you eat, your diet, your activity pattern, and there are very strong relationship between your sodium intake and high blood pressure. And there are potential mechanisms include abnormal kidney handling of sodium, your sympathetic tone, and increased activity of renin-angiotensin system. So basically your lifestyle is very important because your lifestyle can lead to increased sympathetic tone, and that can lead to vasoconstriction of arteries and release some hormones which can lead to high blood pressure. And chronic exposure of these conditions and sympathetic activity can lead to high blood pressure. High blood pressure can be managed with lifestyle modification, and it also requires starting you on medication. But regardless of whether you take medications or you don't take medications, your lifestyle is very important. And the most efficacious lifestyle measure is weight loss. and you lose weight because of activity and lifestyle modifications. Sodium restriction is another very important measure for controlling high blood pressure. And most of you have heard about DASH diet. DASH diet means dietary approaches to stop hypertension. And it mainly consists of grains, fruits, vegetables, low-fat dairy. It also includes a little amount of fish, poultry, legumes. I also encourage using nuts and seeds, and try to avoid saturated fat diet, meat and sweets. Potassium supplementation is also recommended, but I encourage to take fruits which are high in potassium. Especially you can have avocado, which is very high in potassium, banana, which also has potassium, but most of the fruits, they have high potassium, so it helps your blood pressure. Your physical activity is very important. It lowers your blood pressure by approximately 8 to 10 degrees if you are active. And physical activity has multiple benefits. It lowers your weight, it keeps you fit, it keeps your cardiovascular system fit. So exercise and regular activity at home is also good for high blood pressure. If somebody wants to drink alcohol, they can have in moderation, but I recommend not to use it. If you smoke, please stop smoking, because smoking causes hypertension directly, indirectly, and it can also affect your heart, your brain, if you combine smoking with your high blood pressure. And if you have high blood pressure, smoking makes it worse, because smoking is a stimulant and it increases sympathetic tone, which can lead to vasoconstriction and cause high blood pressure and worsening of high blood pressure. So stop if you do smoke. I strongly recommend mindfulness. There are different ways you can do mindfulness, like meditation, yoga, prayers. And mindfulness actually means whatever you do, you enjoy it. And you need to be present in that moment and be attentive. So even if you're doing exercise with focus, it's mindfulness. You pray, it is mindfulness. And while you're praying, be attentive, that is mindfulness. Sleep is very important for high blood pressure. So I recommend sleep on time and sleep for at least 7 to 8 hours. We do not pay attention to sleep because we think sleep has no importance. If you do not sleep properly, it will bring hormonal changes in your body, especially you develop insulin resistance that can lead to metabolic syndrome, and high blood pressure is one component of metabolic syndrome. Your blood pressure will definitely come down if you sleep regularly on time and you sleep 7 to 8 hours, because your sympathetic tone reduces with a good night's sleep. And always remember, self-monitoring is very good for your blood pressure. So if you do self-monitoring at home, you can have a better control on your blood pressure. Pharmacological management, which means treatment with medications. Don't be afraid of medications, because yes, I do understand that they have side effects, but if your blood pressure is not getting control with lifestyle modifications, then you need to take medication, because our goal is to control blood pressure, regardless of whether you take one medication, you take 2 medications, or you take 3 medications. So in combination with lifestyle medicine, if your doctor prescribes you medication, take it, because multiple clinical trials have revealed that controlling blood pressure with medications lowers your mortality, lowers cardiovascular risks, reduction in stroke, reduction in myocardial infarction, which is heart attack, and heart failure. So take medication on time. So I give you a very simple example. A lot of times I come across patients who think that blood pressure medication will give you side effect. So let's assume that that side effects is this much. But if you don't take medication and your blood pressure remains elevated, you're causing this much damage to your body as compared to this much. So the medication side effects is this much, and the side effect or the damage causing by blood pressure to your body is this much. So take your medication on time and take blood pressure seriously. And what is hypertensive emergency or hypertensive crisis? So as I mentioned earlier, if the higher number is greater than 180 and the lower number, which is a diastolic blood pressure, it is greater than 120, with some other abnormalities, we consider as hypertensive emergency or hypertensive crisis. If you see these numbers, call your doctor immediately or go to emergency room, because if we do not take care of this blood pressure, then you can have heart attack, stroke, you can have a bleed in your brain, you can lose your vision, and in some cases, in older patients, they do have change in mental status as well when their blood pressure is very high. So this is a very serious condition, so take it seriously. And the final message for you guys is be knowledgeable about high blood pressure. You should always know your numbers. You should always self-monitor your blood pressure. Make a good partnership with your doctor so that you both can manage blood pressure appropriately, because it's a teamwork. Your doctor cannot do magic. You need to take medication on time. You need to change your lifestyle, especially your diet, your exercise pattern, as I mentioned earlier, mindfulness, and in the end, change your lifestyle, because it is a lifestyle related medical problem. So your lifestyle is very important. So change your lifestyle. Thank you very much.